Who's down there?
Right, and they
come back.
there's some audio.
Get down 4-0 going in the 7th.
Right, they come back.
And he comes back and he says, "I'll tell you, man, that's what you call mental tough. That is something else." I don't know what's going on. Do they know they're supposed to be up here?
Everyone else is over.
Better get up. You're supposed to be up here. Mess it up, buddy, because you got to lead us all if you drop them. You're not going to make us look good. Tell you that today. Nice job.
Yeah.
Good afternoon. My name is Patrick Allen. I'm the Director of the Oregon Health Authority. We're here today to talk about the kickoff of the Justice Reinvestment Project. This is an exciting effort that's a first of its kind around the country that tries to pull together the judicial system, law enforcement, and healthcare to talk about how to better meet the needs of those with serious and persistent mental illness who are dealt with in the main by a justice system and an incarceration system that's not designed to meet their mental health needs. I want to thank the speakers that you're going to hear from a little bit today. That'd be Senator Peter Courtney, Senate President, Senate Republican Leader Jackie Winters, Sheriff Jason Myers from Marion County, who's my co-chair on this project, Steve Allen from the Council of State Governments, and Chief Justice Martha Walters. Before we start, I want to talk a little bit about why are we here and try to illustrate the challenges that we're dealing with. About a year ago, I had the opportunity to meet with some folks here in Marion County talking about mental illness and people in crisis and how they interact with different parts of the system. And a representative of the law enforcement system talked about how they wanted their officers on the street to be able to encounter someone in crisis and think to themselves, what are the 10 things that we can do for this person other than taking them to jail or taking them to the emergency department? And the sad fact is, around the state, there aren't enough things on that list or enough willingness to ask those questions or the opportunity or the training to know how to respond for that to be the standard way that we try to deal with folks who are in mental health crisis. And as a result, they often come through the criminal justice system. Over the last 6 years, the number of patients at the Oregon State Hospital who are there because they are unable to aid and assist in their defense, having come through the jail system, has doubled. As we speak today, we're converting a unit of the hospital that is intended to address the needs of those who are civilly committed to the hospital, who haven't yet interacted with the criminal justice system, to be able to deal with people who are referred to us by jails. We're also planning on asking the legislature in December for funding to expand or open a unit at the Junction City Hospital to again add more capacity to be able to deal with these issues. So these are real problems that drive real spending decisions and real treatment decisions and constrict resources around the system in ways that aren't helpful and don't get people the treatment that they need while we deal with this. The Justice Reinvestment Project is an important part of this solution. The project brings together key players from across the state, from all levels of government, from public safety, social services, the healthcare system, criminal justice system, and from both sides of the aisle to come up with better solutions that offer on the street, work on the street, that provide officers with assistance that they need and to help people who are suffering from mental illness without having to involve them in the criminal justice system. The project gives us new data and insights that'll help us identify people who are repeatedly in crisis and in need of mental health and substance use services. It'll help us better target our treatment interventions, and it'll help us better target our wraparound services like housing, medical care, vocational rehabilitation, and other supports. This project also gives us confidence the answers are achievable. We're not talking about the need for unaffordable new investments. We're talking about new ways of collaborating across the system to help people with severe mental illness and use the resources that we already have in a way that's more effective and provides people better treatment. I'd like to now turn the podium over to Senator Courtney.
So thank you, Mr. Allen. I do want to thank the members of the media that are here. I did not think there would be anybody show up. I was talking about my staff, how I ended up here today. I was asked to attend this event and wanted to know what exactly was involved. I started to study a few days ago what was involved, but I didn't know if any of the members of the media would be here, and you are here, so thank you. I don't have any prepared speech. I did have one. Robin Maximoff prepared me with one. It was very well done. But I can frolic, and I was frolicking moments ago. You know that. I'll frolic and tease. But all of a sudden, when you really get talking mental health, I don't frolic, and I don't tease, and I don't kid. And I'm glad Senator Winters is here, and I'm glad Mitch Greenlick is here, Representative Mitch Greenlick. And also Jason Myers, the sheriff, and I'll tie them all in. I'm not going to speak forever, so don't worry about that. I came to mental illness as an issue in terms of when I might be late in my legislative career. I make public policy. Senator Winters makes public policy. Mitch Greenlick makes public policy. That's what we do. We're public policy makers in the state of Oregon, and we also pass budgets. And so we pass laws. We pass bills. And we struggle sometimes of trying to deal with suffering that's going on in our community. And there's two thoughts here. You have the law enforcement community, and I was talking to the Chief Justice, Martha Walters, about this. They're under siege day and night, the law enforcement community in our state. And yet they've got to find a way to maintain the law and order and the peace, but also take care of those that are suffering. And they're often put in an impossible situation. And that is the thing I want to emphasize today. There are situations out there, they may even be going on right now, and probably are in some counties, some part of the state, where an individual is struggling with mental illness, and all of a sudden there's a police officer in their life. It is a very bad situation. And the police officer is in a very difficult situation of what to do, because things are not good. And we apparently did pretty good in 2013. We created the crisis response teams. And I didn't know we had done that. I mean, I know we did it, but I didn't know what it was going to do until Sheriff Jason Myers visited me and actually thanked me, which surprised me because he's never supported me, but he surprised me by saying it had made all the difference in the world to the Marion County sheriffs who had to go out to these situations, sometimes in the middle of the night, sometimes in a rural community, and help the law enforcement officer avoid a catastrophe. But what is happening, we're finding statewide, is we don't have the kind of sheriff, well, be careful, now you'll get in trouble, Peter. Not every county has what Marion County has. They don't. And I'm not putting down the other counties, because that's not what this is about. Because what happens, either someone gets badly injured, and you know what I'm talking about, I could go further, or they end up in jail or the emergency rooms. And then when that's over in their lives, they go right back out, and it happens again and again. And I didn't know it, but the experts, and Mitch Greenlick is here, and Senator Winters is here, Pat Allen's are here, tell me, Peter, we're not reaching that many people this way with these response teams, all through the state of Oregon. Many of these individuals that end up in our emergency rooms in these situations are in our jails. Peter, that's not where they should be. And we've got to do better. So as my understanding, what we're about here is we're supposed to take the resources that Senator Winters and Representative Greenlick has in terms of our state resources, not only existing resources, but maybe even some additional resources, and try to make sure that the Jason Myers of this world will be everywhere in the state of Oregon, that all our law enforcement people and our mental health experts and our crisis response teams are on the go. Apparently, these crisis response teams are remarkable. I mean, they go right now to help that law enforcement officer. We just got to get more of them. We got to do a better job in identifying these people when they're in one of these mental health episodes. I think that's the proper way to say it. I don't know all the words. I'm trying to say the right things. We're trying to make sure that if we can do that, as well as we're doing it perhaps in our backyard, Your Honor, the doggone it, we will break through in a way that will be remarkable for our law enforcement community, most of all for that person who's suffering mental illness. So when they asked me to be here, I didn't know what to say, but I understand this is a pretty good thing we're trying to do here. We're really trying to do something significant. So I'm honored that I'd be asked to speak. And Senator Winters, you and I, if I win my re-election and everything, Mitch, if I win, we got a lot of work to do in 19, because this battle about mental health will never end until we can mainstream mental health in our society. Get that? Until we can mainstream mental health in our society, we may have to hold a lot more of these press conferences. But if I got Mitch and I got Jackie on my side and Jason, I'm being very sort of informal now, you know what I mean? I don't mean to be disrespectful to their titles. But I'm saying, then I think we got a pretty good A team to start with. I'm on the bench, they're starters, but I feel pretty good. Thank you.
Thank you, President of the Senate, Courtney. You know, I'm Senator Jackie Winters, and as you know, I actually am also the co-chair of Joint Ways and Means Public Safety. And in 2013, we passed legislation that would allow us to begin doing the justice reinvestment. Which is also coming forward to today, and I'm very proud of Marion County. I've got to tell you, because it's also the county, when some legislation that we could not pass, that they went ahead and did it anyway. I think what we're talking about today is long overdue. You know, we tend to, in this building, actually address issues in silos. This is an issue now that we're coming together to collaborate, not just talking about the corrections, and the work that's being done within our communities for mental health and the mentally ill and the homeless, but also bringing with that the Oregon Health Authority and all the other agencies that have an impact on this particular issue. In addition, probably one of the most difficult to do in this building is to bring everybody together to share data. And it's critical when you start talking about being able to make informed decisions, being able to develop, to find out where resources are or not, in order for agencies actually to work together in order to share that information. And this component of this initiative and work group, I think, is critical. You know, I've been around these halls and these buildings for a lot of years, and probably one obstacle that exists, and that's that obstacle of data sharing among the agencies in order to make certain that we're bringing everybody together in order to make good decisions. I said when I was asked to be a part of this committee, one is that they said that Jason was going to be the co-chair. And knowing the work that we're doing here in Marion County and bringing corrections, public safety, and OHA together, in and of itself, will have far-reaching implications as we go forward to do policy. That policy that exists not only for the mental illness, which I would agree with my good senator. It is long overdue that we begin to mainstream and bring that community, those individuals inside of our community. In addition to that, he mentioned the hospital. If you follow what happens within the communities, the jails are not a place to treat mental illness. The emergency room in the hospitals is not a place to treat the mentally ill. The lack of support that exists within our communities is staggering. Staggering. The training of the officers who are having to actually go in to diffuse situations and to actually become your eyes and ears and your support, they too are stressed. So, you know, for me, when I was asked to do this, I said, gosh, it's like going back in time and talking about when we actually truly did coordinate, collaborate, and then come up with solutions in order to solve the problem. So I'm very honored to be a part of this. I look forward to working on the steering committee and with looking at the members that are there. I'm certainly that we will actually come up with not only good policy, but also are able to actually maximize those resources that currently exist before talking about adding new resources to it. So thank you for including me, and I look forward to working with you.
Thank you, Senator. Sheriff?
Thank you. My name is Jason Myers. I'm the Marion County Sheriff. It's a privilege actually to be on this committee and to be a co-chair with Director Allen. You know, since starting my career, I learned early on that just about every other contact I was having with folks in the community, I was dealing with somebody that either had a mental illness or was in a mental health crisis or had a substance abuse issue. And over the course of my career and over the course of the last 10 to 15 years, we've done a really good job of helping law enforcement officers be trained in the areas of identification when somebody is in crisis. So we're doing a good job at the training. The issue then becomes, what do we do? Because we have limited resources in law enforcement, and we know that somebody who is at the point of having a mental health crisis, that jail isn't the right place for them. The criminal justice system is not the right place for them. So we've been successful in our county of developing community-based resources where we can take somebody that's in a crisis and move them to a community-based resource and not to our jail. Now, are we successful every time? No. Is there more work to be done? Yes. I'm hopeful through this process what we can do is identify these programs, identify resources, identify leadership around the state so that we can create a holistic system that helps people in a time of need, directs them to the services that they can get, and keeps our communities safe. So I'm very excited about this process. I look forward to working with all the individuals on the task force, and I look forward to great results. Thank you.
My name is Martha Walters. It's Halloween, and I'm not masquerading in this new job of Chief Justice. It's something I started in July, and it's very exciting to get these opportunities to work in partnership with the other branches. I'm here representing the nearly 200 elected judges in our state who are committed to this project. And the reason that this project is also so important to the courts, and the reason that we want to be partners and collaborators on this project, is because our judges see the people we're talking about in our courts every day. Some of them are defendants in criminal cases. They can be charged, some of them with very serious crimes, others with less serious crimes, but the things that they're charged with have affected the quality of life in our communities. Each of these people has statutory and constitutional rights, and judges want effective options to not only respect those rights, but also to protect the public safety and restore these people to their communities. And we think that we're in a position to be able to help with these efforts, because that's where the direction often happens. Are people directed to the jails? Are they directed to the hospitals? It happens many times in the courts. And the work that our judges do affects all of these systems that we're talking about, and I've talked with both Senator Winters and Senator Courtney about how things can be siloed, and they can be over here being the legislature, and we're over here being the courts, and we've got the hospitals and the public safety, and we can be siloed and only looking at things the way it comes to us. But it's important that we understand that we are connected. Public safety, behavioral health, family services. Our courts deal with families in crises, and we can identify things early on where there can be prevention. So we think that looking at this as a systemic approach is really important, and we rely on partnerships to get our jobs done. We've got drug courts, we've got mental health courts, veterans courts. They're good examples of how partnerships can work. They take more judicial time, but they produce better outcomes for the defendants in the courts and for the people whose public safety is trying to protect. So we want to be partners in these good government efforts. We're thrilled about this project. We think it's important to maintaining the public's trust and confidence in our courts, and we're just very appreciative of being able to join in this important project.
Thank you. Steve?
Thank you, and good afternoon. My name is Steve Allen, representing the Council of State Governments Justice Center. In a few minutes, the first meeting of Oregon's Behavioral Health Justice Reinvestment Project Steering Committee will meet. That steering committee includes a broad range of Oregon stakeholders, including legislative representatives, including those here today, county representatives, members with subject matter expertise, law enforcement, the courts, and people with lived experience. We will be covering three broad subjects today: housing, the Oregon State Hospital, and an initial review of 8 jails of data. Those data are quite interesting in our view and will be matched with additional data, including Oregon State Hospital data, Medicaid data, and community corrections data. Those data that we'll talk about today show a profile where a small group of individuals have an inordinate impact on Oregon jails. 6% of jails, for instance, in Clackamas County, a county of approximately 400,000 population, account for almost 20% of all bookings. And put in numbers, that's 569 individuals accounting for over 2,800 separate booking incidents in the course of a year. As we look at layering this information and connecting it with other data, we'll begin to get a picture of how these individuals interact, for instance, with the Oregon State Hospital. Are they going in on civil commitments or aid and assist? What is their healthcare utilization before and after jail? So we, at the end of this project, we'll have some really interesting data that can help guide policymaking decisions as this project moves forward. I want to thank everyone here today. Oregon has some extraordinary strong leadership, including the people standing up here with us today, who are already exerted strong leadership and a commitment to this project, and we look forward to ongoing conversations as this project moves forward. Thank you.
Thanks, Stephen. Thanks, everyone. This problem, people with serious mental illness being referred to jail cells and beds in emergency departments that aren't equipped to provide them the treatment that they need, can't be solved by the healthcare system, can't be solved by law enforcement, it can't be solved by the legislature or by the courts or by our corrections system, at least certainly not any of those entities working by themselves. I'm very hopeful, though, that by bringing all of those voices plus others together and looking at hard data about how the system works, that we've got a real shot at being able to articulate important strategies and investments that we can make that really can make meaningful progress in this problem and do a much better job than we do today in Oregon in meeting the needs of those with serious mental illness. With that, we'd all be happy to answer questions. If you could let us know if you've got someone specific in mind for the question, that would be great.
The steering committee, how many members does it have, and is there a list of the members on the website?
Yeah, there's a list we have available. It's 28 members, excuse me.
The list is on the website, or is that something that...
Oh, we can get the list out too.
Okay.
Yeah, Dick.
I would like to know more about the specifics of how this will work, what you hope to achieve. You've talked about the broad strategy, but for Oregonians, if this works, what could this mean on a ground level?
Well, let me take a crack at that, and then I'll see if anyone else wants to take a shot. I told that story about the fact that we're converting space in the state hospital today, literally today, to be able to accept more referrals from jails who are unable to aid and assist in their defense. That's often how these get categorized when they come through the jail system. Those folks don't receive treatment. They receive stabilization, and they receive some basic understanding of how the court proceedings against them are going to work, and then they go back to the system with their mental illness effectively untreated. And in converting that capacity, we're taking away from capacity at the hospital level that provides treatment. That cascades all the way down through the community, where we've got different kinds of treatment available at different levels of seriousness and at different levels of security. And the whole system is really effectively overtaxed by the way that we're inadequately meeting the needs of people today by cycling them through in an untreated condition. I'm hopeful that what will come from this, by being able to look clearly at this cross-sector data and work together across different sectors to solve problems, is to figure out how to make that system and the investments we've already made, which are significant, work better, so that the system that's in place today does a better job of actually meeting the mental health needs of those who are referred to it.
So would this be treatment in the jail, or it would be, I don't know whether this is connected with LEAP that the Marion County is involved in, or...
Yeah, I think that's leaping to the end of the story a little bit, but the general notion is to be able to use the data and the experience of the people on the steering group as well as the council to identify what are those strategies that are most effective. Steve, do you want to add to that?
That's exactly right, Director. This process will lead to a series of policy recommendations for the 2019 session. What those policy recommendations will be, as the Director said, are not yet known. What we have done as part of the Council of State Government's justice process, we've visited 27 of the 36 counties here in the state and talked with dozens of stakeholders from all levels of government and support services. And so we're, in addition to the data, gathering a fairly clear picture of what the local challenges are, and frankly, they're different from county to county, as you might expect. So part of the challenge in developing policy will be creating policy that's flexible enough to address the needs that are different in Marion County, from Malheur County to Multnomah County and Jackson County, because each of those counties has some of the pieces of the infrastructure that they find really useful. There's been a lot of innovation. There's some real gems in terms of what's being created here, but we are also hearing that there's some critical missing pieces, and so that's, I think, where this project will ultimately lead.
Are there particular counties that are doing really well now?
Yes, and yes, we've seen some great examples, but at the risk of offending counties I don't mention, I'm not going to call any out at the moment.
Do you expect that this is going to cost more money, or is it going to be a question of taking some money from criminal, from the jails and putting it into healthcare, and that's when the silos thing can get kind of difficult?
Yeah, I think it's interesting. I've been doing this for a little bit more than a year. And it's not an area that I came into this super well acquainted with. But I will say that the two things I hear real consistently is we don't have enough resources from people who are doing the work and from legislators and others. We've been doing nothing but putting resources into it. And so I think Senator Winters would like to answer this question.
Would you repeat your question?
Yeah, so is it going to cost more money, this program, or is it a question of taking some money from one silo and putting in another, because that can be difficult?
I'll answer it this way. First of all, we don't know until we get all of the data and get it refined as to what the recommendations are. Secondly, hopefully, as we do the analysis and get all the data collected, when we did justice reinvestment, for example, that program, as you know, actually said to the community, we're going to give you these new dollars, which we did, and in getting those new dollars, we expect certain results, which happened. So there's several ways of looking at that, but I think you can't determine whether or not it's going to take existing to either shift dollars, which could happen, or whether in the analysis and the final results that you may need new revenue. What I think is exciting about this, because we were talking about, we don't know what is, and I'll give you an example. We're talking about drug courts. Drug courts work. However, not all drug courts are the same. Not all drug courts exist throughout the 36 counties. And so I've been pushing for mapping to determine what is. You cannot make informed decisions unless you know what is. That's why I'm excited about this, because this gets us to a place of talking about the data and looking at it and determine what is before talking about the issue of resources and how resources are deployed.
Well, wait a minute. I know that's good. I'm disappointed. First of all, I'm frustrated. I thought, Dick, if you listen to us individually and collectively, you'd understand what we hope to have happen here. So I'm not going to repeat all of it. It's very simple. You've heard about judges who are literally, as we speak, on the bench in the trial courts in the state of Oregon. They're on the bench. There are county sheriffs in courtrooms as we speak, or at least deputies, as well as city police, as maybe even state police. You got it? You got DAs in there, criminal defense. Everybody knows the 5,000-ton chicken in the middle of the room is this person is mentally ill, but we're going to treat him as though we're going to put him in prison or, something like that. Everybody knows that's not what should be done, but their hands are tied for whatever reason, whether it's because the judge has a lack of discretion, whether it's because we don't have laws. We know that. We know that. We've talked about mental illness in corrections for as long as I've been here. The number of people who are locked up that are mentally ill and you're not doing anything for them. So it's hopeful that we will not be in that situation when we get through this. We have a person in front of a drug court or mental health court, Veterans Court, a general court, and the sheriff meets with the DA or whatever, and the defense attorney and say, you know what? They say, yeah, let's go. The person belongs here, where they can get treated. So that's the biggest breakthrough. And I could say more. The money of cost. All right, I'm going to make cut. It's going to cost more money, and there will be a shift. How much? I have absolutely no idea. And the reason there's shift, so you don't go out of here and say it, everybody scramble like he's going to cut my program is, we know, Senator Winters, I'm glad she spoke, knows better than anybody. Some of our priorities are going to shift in criminal justice dramatically. If not in 19, they're going to shift in the next 10 years because we know we're locking up way too many people, keeping them long, and many of them are mentally ill. So that is going to shift. And we're sending a signal today, Senator Winters and I and Mitch, that we're here to have that overseen in a way that's never been overseen before. Other states are actually ahead of us, I'm saying. I'd like us to be first. We got even the reentry thing, which is part of this as well. So I don't mean to be frustrated, but we assume this is going to create monumental change in how we look at mental illness and the people who get involved in the criminal justice system. All due respect, CSG West, CSG, I'm happy. That is very important because we're not just doing this, 28 people running through this exercise and fooling around. Senator, where does it take?
But I think what's very, very important is that we're addressing the issue that exists. And that issue that is not appropriate for the jails to be this place for the mentally ill. It
Or
isn't
emergency
are
rooms.
the emergency rooms in our hospitals. It is not important that the criminal justice the system is actually sending people to DOC that maybe could be treated and diverted someplace else. That's not what we should be doing. And so we should be looking at the issue that exists within our communities and how do we, number one, treat the individual. How do we take care of the individual with mental illness, the homelessness that's in our communities, without sending them into our criminal justice system? So, I mean, this to me, the steering committee that's working, I was very excited to hear. And I was more excited when we talked about data sharing, because that often is at the heart of us not getting to the place where we need to be of making the very informed decisions that we make.
It's more than a quarter of a century ago when we opened up the snake pits and took the Locke State Hospital population and sent them back to the community. At that time, we promised a robust community mental health system. And the fact is, that system never emerged the way it needs to emerge. We are now beginning to look at that in a very serious way, and we're bringing a set of lenses to that, including a criminal justice lens, a homeless lens, a substance abuse treatment lens. But we, in this coming session, both the House and the Senate are very committed to beginning to rebuild an integrated community mental health system. This effort we're doing now is worth doing because it's a very important piece of the problem when you fail to provide the resources that are needed in the community. We need to find a way to make those resources available. It'll deal with the homeless problem, it'll deal with the substance abuse problem, and it'll deal with the criminal justice problem. And we're all strongly committed to making that happen in this coming session.
We've got time for one or two more, yeah.
I'm just trying to get my mind around the basics of what's happening here. You've got a steering committee, and are they proposing legislation? Do they have a timeline for that? What was the impetus for the steering committee? It looks like it's federally funded. How much in federal funds? What kind of funds, that kind of stuff?
Sure. So working backward, the timeline is to complete this work by the end of February, so that it's still very early in the legislative session. The idea is to bring forward a set of policy recommendations. That's kind of an intentionally nebulous word because those could be pieces of legislation that we need. Those could be budget decisions that we need. They could also simply be actions that agencies or others take in the administration of their programs. As an example, we're in the middle right now of designing the process for the next round of coordinated care organization contracts as part of the Oregon Health Plan. And so this work could help inform the work the governor's directed us to do to talk about better integrating behavioral health with physical health in that system. So the idea is to do this work over the next 3 months to be able to come up with those policy recommendations. The steering committee will ultimately sign off on those. The council will work with us beginning today, presenting data that they have found in the initial months of the project to be able to give us a framework to start having those policy conversations.
And what is the funding behind this? I just saw in the press release.
Yes, it's a grant from the council. Do you want to speak more to the funding, Steve?
Sure. Our involvement is paid for through the Bureau of Justice Assistance and Pew Charitable Trusts. And so we're here at no direct cost to Oregon taxpayers, although as Director Allen and others can attest to significant sweat equity by state stakeholders.
One more question.
Sorry. Another just like money thing. You said that you were expanding capacity in Junction City. By how many beds and how much is that going to cost? And do you already have the money for it, or do you have to ask?
Yeah, no, we're going to come to the emergency board in December and ask for resources to open approximately a 25 or 30 bed secure residential treatment facility unit in Junction City, which will help us have more capacity here in Salem, which is where we typically deal with this population. We'll need resources to be able to do that. I don't, but I can get you that. Yes, it's our, yeah, we'll be here in December to talk about it. We've already submitted the request, yes. One more question. Great, thanks very much.
Here we go.